Jen. I'm going to be your nurse today. How are you doing?
Excellent. How are you?
I'm pretty good. So I hear that you're coming in to try to quit smoking. So we'll go over that just in a minute.
Mhm.
I brought you some papers for that. So I'm going to go ahead and hand these to you now.
Okay.
And then can I get your name and your date of birth?
Yeah, it's Blake Sharp. And my date of birth is June 9th, 1999.
Okay, so you are here to try to, you started smoking how long ago?
About 2 years ago, and I've just been noticing, my stress has been up since then, and I just wanted to come in and see if there was anything that I could do to, maybe prevent that.
Okay. I see. Well, there are some health effects to smoking that I'm not sure if you're aware of or not. So, as you probably know, smoking can cause cancer, but it doesn't just cause cancer in the lungs. You can actually get cancer in multiple areas of your body from smoking cigarettes. Many organs can be affected from smoking. So, have you heard of COPD?
I've heard of it, but I don't know what it is.
Okay, so COPD stands for chronic obstructive pulmonary disorder. It's a disease. Um, it's a chronic inflammatory issue with the lungs, and you get an obstruction of airflow that's going on. And so it happens a lot that we see with smokers. And so some symptoms that you might get is difficulty breathing, coughing. You get some mucus, which is like the secretions that you would cough up. Um, and then sometimes you can get some wheezing, and we see that with emphysema, with long-term smokers. So there's many risk categories that smoking can cause. And
Mhm.
it can even cause problems with your immune system. I don't know if you were aware of that.
How does that work exactly?
It's kind of interesting, actually. So smoking harms your immune system um, in a way where you have your immune system is there to fight disease. And so it's your body's way of kind of protecting itself from infection, disease. And so when there's an imbalance, you might have heard of homeostasis from whenever you were in school. So your body wants to stay in homeostasis. Smoking just throws that completely out of homeostasis. So your body kind of, you can get this inflammatory response. And this can increase your risk for several immune or autoimmune disorders where your immune system can mistake and attack its healthy cells and its tissues. So none of that sounds very good, does it?
No, no, not at all.
So I bet you want to know how you can quit.
Yes, absolutely.
So quitting is a journey. I'm sure you've probably tried to quit maybe before. Is that right?
Yeah.
Yeah. So quitting is a bit of a journey. You can minimize your withdrawal symptoms though by using something called a nicotine patch, and it goes right onto your arm. It can go into the back area, and that is a way for us to kind of decrease your nicotine over time a little bit slower, so you wouldn't have the same like with the withdrawal effects from it.
Hmm.
Um, you can also giving up things that might be a trigger. So like alcohol. Some people when they go to the bars, they smoke with their friends. Does
Hmm.
that happen to you sometimes, where you hang out with
Yeah,
your buddies?
it's really easy to sort of get caught up like that in social situations.
Absolutely. And it happens to the best of us. Even a simple cup of coffee can actually be a trigger for some people. So, those are some things that can help you not become so triggered with wanting to have a cigarette. And then finding those ways, because you were talking about stress.
Hmm.
So, of course, smoking a cigarette causes you to kind of like take those breaths.
Hmm.
So how do you take those breaths without, taking a,
Hmm.
a drag of a cigarette?
Hmm.
There's different ways that you can do that. So you can take slow, deep breaths, like going for a walk, being mindful of taking those deep inhales and deep exhales. And that really kind of helps us to just calm and relax in general. Let's try
Mhm.
one right now. Like, take a deep breath in. See, makes you feel just a little bit calmer. And
Mhm.
so
Mhm.
you can continue to do that and develop that practice, even if you're still smoking a few cigarettes. Like, try to, instead of, I'm not going to smoke a cigarette this hour, I'm going to take a deep breath. I'm going to just kind of
Mhm.
chill. I'm going to relax. Those are all ways that are super helpful for helping get us in the mindset of quitting and to also reduce the stress. Um, there's also, because there's the hand to mouth motion. So
Mhm.
some people, um, some people will use a lollipop. Some people will hold a stress ball and just kind of
Mhm.
walk around like with the stress ball.
Mhm.
Um, I've had patients that use worry rocks, and it's just a way to like be mindful and kind of have it in your hand, and you can,
Mhm.
move your fingers, use the just
So to
kind
use
of,
it like a fidget?
yeah, so you can just
Okay.
kind of feel around.
Mhm.
Anything like that might be great for you. Those are just some tips. And if you want to know about the benefits of quitting now versus later, is that something you're interested in?
Absolutely, yeah.
Okay. So I don't know if you have any family members that also smoke cigarettes. So if you do, you have anybody that smokes cigarettes?
Absolutely, yeah.
Okay. So with that, it's very interesting. So quitting smoking can cut your cardiovascular risk significantly. For example, 1 year after quitting smoking, your risk for heart attack drops sharply.
Wow.
10 years after quitting smoking, your risk of dying from lung cancer is cut in half. Pretty
Wow.
amazing. So I hope these are, just some techniques, some ways that might kind of trigger things in your
Yeah.
brain to think about quitting.
Yeah, yeah. It's a lot of really, really helpful information. Thank you so much.
No problem. And so I'm going to check in with you soon on your progress. I'd like you to come in for another visit. If you would like, there's other discussions that we can have about possible medications in case these techniques don't work. And like I said, quitting's a journey. And really take a look at these pamphlets.
Okay.
And read them. And there's some resources on there. There's some support groups. Do you have any questions?
No, that's perfect. Thank you so much.
I'm really excited for this journey that you're on, Blake. So let me know if I can be of any other help to you, okay?
All right. Thank you.
All right. Have a great day.
Yeah, you too.